Chapter 24, 24.1. Match the two part of the sentence. 1. 1988 saw the United Kingdom launch of live attenuate G. Miss Missless Mons Erubella MNR vaccine. 2. Chicken pox varicella is a common infection. E. Disease of child who. 3. Um, previous as an incubation. A. Period uh, ranging for from 4 days to many months. 4. The patient remained febrile. Age with pins of temperature for 39.5 grade Celsius. 5. He was admitted with a 4-day history of influenza type symptoms of fever with V rigors mild agia and general malaise. 6. Quite a portion of patients who recovered from hepatitis V C become caru- carriers of the virus. 7. The central part of Africa is in the midst of an epidemic F of AIDS. 8. Measles rubella is mod. D. Infections during the catarrhal state. 9. Lyme disease is caused by transmission G of the burdoferui from animal to man by otitis. 10. PUO stands for I. Pyrexia of unknown origin. And 24.1. Complete the case reports on the patient in a opposite. Case 45. On examination, he on examination he looked on wall. His pool uh, rate was 100 minutes. He had a papa spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 at 14 days. In this case, the patient admit he had not VE taking prophylaxis regularly. The diagnosis was confirmed by the presence of paresis in his blood blood film. 24.3. Complete the sentence. 1. A infection with can be treated successfully with antibiotic is curable. 2. Another word for a pandemic is an outbreak. 3. Bacteria and bacteria and viruses are example of microorganisms. 4. Someone whose temperature is normal is appeared serial. 5. The common infection with Spain barbarous is known as glandular fever. Chapter 25, 25.1. Complete the table. We were from A, city, and E opposite. Noun and adjective. Affect, affected. Anxiety, anxious. Behavior, behavioral. Dementia, demand. Disturbance, disturbance. Suicide, suicidal. 29.2. May word combination using words from HBOTS. Be, uh, behavioral syndromes, erring, disorder, major depression, mental retardation, personality disorder, physiomotor retardation, sleep disturbance, substance abuse. 25.3. Complete the sentence. 1. A way a person behaves is his or her behavior. 2. A persistent emotional state is a nut. 3. A sudden attack of anxiety is a panic attack. 4. The form of dementia associate with a hand is called sensory dementia. 5. A disorder which is not associated with pathology change is functional. 6. And the idea which forces a patient to repeat unnecessary action is a compulsion. 25.4. Which symptom of depression was this patient suffering from? Okay, case 41. A 15, 6 years old woman presented to her GP complaining of increasing tightness over the past few months. She had lost interest in much things. She was uh, she was living poorly and tended to wait up early, but they need any suicidal tendencies. She was 30 and was pacing urine more often. She was eating normally and her weight was steady. Tinnitus, fatigue, loss of interest, sleeping poorly, insomnia. Chapter 26, 26.1. Complete the table. We work from A, B, and C opposite. Adjective and noun. Blind, blindness. Conscious, consciousness. Deafness. Diseaseness. Numbness. Light, 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 light-headed, hated, light-headedness. Unsteady, unsteadiness. 26.2. Main words combination using a word from HBoss. Double vision, ability, abilitic fits, prodromal symptoms, syncopal attack, urinary incontinence, visual acuity. 26.3. Complete the doctor question. Do you lose consciousness suddenly or gradually? Do you had a warning of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Did you feel dizzy or light Harriet, excuse me, before the attack? Um, did you lose control of your bladder? Did you did your wife notice any involuntary movements when you were unconscious? Chapter 27, 27.1. Complete the table. We work from A and V opposite. Noun and adjective. Absence, absence. Diminution, diminish. Flaccid, flaccid. Spacity, Spacitic, Weinstein, Weinsteins, Weinsteins. 7.2. A doctor is with being intrusion to a patient during examination of the motor system. Identify what a doctor is assessed in age kinds. 1. I like you to relax and use one to move your arm up and down. Muscle muscultone. 2. Say I see you hand, muscle bulk, and a possibly involuntary movements. 3. Now I'm going to straighten your arm out. Try to stop me power. 4. Can you touch my finger with yours and then touch your nose with no. Do it again with your eyes closed. Coordination 27.3. Complete the sentence. 1. A flaccid and drops limply to front are right ingly with the grits. 2. Breath flats are flats that are stronger than normal. 3. Muscle wasting means the muscle is reduced in bulk. 5. A cane is often used to test the plant to rupture. 6. High condition was poor. I could not perform rapid alternating more movements. 7. A tandem reflex hammer is used to take reflex. 8. When something is diminished, it is less than normal. 27.4. A patient is brought to A&E in coma when her name is spoken. She opened her eyes, but she does not answer question or obey introduction. What is her GCS score? GCS 5. I opo- I opening I opening to speech is 3. Verbal verbal response no no one. Motor response no one. Chapter 28. 28.1. Complete the table with word from. Verb nouns, adjective. Qualitative. Excessive, exception. Growth, growing. Invert, invade, invasion, invasive. Ostrich, obstruction, obstructive, palliate, palpation, palpate, palpable, spread, spread, spreading, squeal, squealing, squealing. 28.2. The note below are about the patient describing in the opposite. One number 6. On examination, his temperature was 37.8 grade Celsius. And to number 3. There was a small first 3 teams 4 centimeters mass in the right supraclavicular fossa. 3 number 7. There were enlarged lymph nodes in both axilla and inguinal areas. 4 number 2. His mouth and throat were normal. 5 number 8. His pulse uh, rate has 100 mean regular on blood pressure 100 to 112 plus 60 plus 66. 6 number 4 and his this diosqual his diovascular and respiratory system are normal. 7 number 5. On abdominal examination there is a mass palpable 3 centimeters below the left costal margin. 8 number 1. Examination of the central nerves of, of the central nervous system 1 normal. 28.3. Complete the sentence. 1. Distant spread of tumor cells is known as um, metastasis. 2. Many symptoms of cancer, such as difficulty as, as walking, are due to attrition. 3. The opposite of painful is pain pains. 4. A milligram nail plants in college a cancer. 5. Tumors which do not invade, invade, invade or metastasis are benign. 6. Secondary tumor are those which result from the sprint of primary. 7. If occurs in not possible palliative treatment should given. 8. A palpable liver suggests metastasis. Chapter 29. 29.1. Complete the sentence. 1. A baby that is born a week before the EDD is premature. 2. A termination of pregnancies may be necessary for medical reasons. 3. The first 3 months of pregnancy are known as the first trimester. Trimester. 4. Fetal distress in the first stage of labor is an indication for caesarean section. 5. If was in is it was a breech presentation and delivery was V for sets. 6. A miscarriage is another term for a spontaneous abortion. 7. The cord was wound tightly around the veins neck, and it was unfortunately stillborn. 29.2. Complete the table with words from apposite verbs and noun. Abort, abortion. Deliver, delivery. Induce, induction. Miscarry, miscarriage, excuse me. Present, presentation. Terminate, termination. 29.3. The Dr. Ben and SHO is presenting a patient at a wedding middle in the obstetric unit of a hospital. Complete the presentation with the correct from of birth from 29.2 above. This is Clara Davis. She comes the ante, the antenatal clinic at 9 weeks. In her past obstetric history, she had a pregnancy when she was 18 weeks, was terminated, and another one a year later, which spontaneously miscarriage. Since she has had the pregnancies in the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The, the tear baby present as the breech and was delivered by caesarean section. Chapter 30. 30.1. May word combination using a word from HBOS. Blood, stained. Bread, sons. Plural, group. Production, co. Vocal, resonance. 30.2 reach wide the cohesions using words that are better known to patients. Excuse me. 1. Is your cow production? Do you cow open a plant? 2. What color is spunton? What color is the plant? 3. Is it ever purulent? Is it ever yellow? 4. What you ever had hemoptysis? Hemoptysis? What your nourish any blood in it? 5. Do you suffer from dyspnea? Any problem with your breathing? 30.3 Are the following statement true or false? With reason for your answers using your medical knowledge. 1. A patient who has a loose co-produce co-produce plant. True. 2. Crackles are hard when the airways are narrow way. False. 3. A patient who has a non-productive co-produces sputum. False. 4. Wheezes are typical of pleurisy. False. 5. A pleural group is a six of asthma. False. Chapter 31. 31.1. Complete the description of birds such the shingles by replacing the medical words in broken with ordinary English words. Childless Jeffers Foster usually starts with pain and soreness, then red spots mucus appear, then develop into group of small blister vesicles over a particular area on one side of the body. In months, pa- uh, in months, in months, patient new spots, lesions continue to appear for 3 to 5 days. The small blister vesicles become filled with pus pustular and then four scabs grouped. In severe cases, there may be cicatrices afterwards. 31.2 Read the description of rash of rubella and complete the note. The spots are scarlet, pink naucune, which appear first behind the gears and on the forehead. The rouge spread rapidly further through the throat and then to the lips. And location and this location and distribution. Birds burst, burst behind the ears and the forehead, then the trunk and limbs, groping and mouthings, color pink, 31.3, complete the note for the rash in the photographs and suggest a diagnosis, location, and distribution. Wow, distribution. White, white print on their chest and abdomen. Groping as carrot type of lesion, small macules hide some scalps. Color pink 31.4. Complete now for the lesion in the photograph and suggest a diagnosis. Location and distribution. Below lateral inhale of the left eyes, groping and seagull type of lesion, nodule, color, white or pink. Chapter 32, 32.1. Why the corresponding medical terms for the ordinary English word and say what king of four is bulbed. Common word medical terms and type of four. Bruise condition, high hematoma, and blood, and cut inside one chart, grazing, and abrasion, blunt, scratch, linear, abrasion, blunt, stab one, and Penet Stabworm penetrating worm sharp tear laceration blunt 32.1 32.2, excuse me. Choose the correct words to complete the description of injuries showing in the illustration. The are graces above the legs, iron, and on the left side of the neck, a condition to the left side of the lower lid, and tear to the left cheek. 32.3 with a description of the injuries showing in the illustration. There is a laceration on the left shoulder and anti-side wound occurred approximately 6 centimeters in length about the left nipple. And 32.4. Complete the sentence. 1. Frequency frequent change of position, are necessary in the immobile patient to prevent the development of a pressure ulcer. 2. He had several stab and wounds in the abdomen from the neck. 3. He was knocked unconscious, unconscious by a heavy blow to the head. 4. The wounds were only superficial and recurrent non-treatment. Chapter 33, 33.1. Look at the conversation in a opposite and complete the note about Mr. Jones. Use medical terms were possible. EO frequency and nocturne for 1 year. No dysuria or hesitancy. Strain. A little weaker. No incontinence apart from occasional dribbling. 33.2. Match the patient description of their symptoms with the medical terms. Look at A opposite to help year. Opposite to help you. 1. I have to ping every half hour or so. V. Frequency. 2. I had a scalding pain when I passed wires. A. Dysuria. 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 3. I have to head up several times to pass war at night. E. Nocturia. 4. I have to reach to to go to the toilet. F. Urgency. 5. I have travel started. D. Hesitancy. 6. I can't I can hold my my water. G. Incontinence. 7. I passed I passed some blood in my urine. C. And hematuria. Hematuria. 33.3. With the doctor, in the doctor question for S of the symptoms in series 3.2 above, you will need to take of your and condition and question for urgency. Frequency. How often How often you urinate? Dysuria. Do you have pain when you urinate? Nocturia. Do you have to head up at night? And urgency. Do you heal and rush to to urinate? Hematuria. Have you urinated with blood? Consistency. Do you have any trouble hairy storage? Incontinence. Do you ever low contour or ear bladder? 33.4. Describe the finding of laboratory re, laboratory report in growth. There was a trace of blood growth protein and no can and no cats. Chapter 34. 34.1. A doctor taking to a patient during an ophthalmoscopy matched the underlying expression she used to expression with similar meaning from eight opposite. Read, right, Mr. Gold, because you have been having this hairy one going to have to give a look at your eyes, particularly the black of your eyes, the retina, and going to put to put to put a couple of drops in your eye watch will make it easier for me to see the retina. After a few minutes, you may find your vision a bit blurry. This will this will of after about hour. I need to get rid of as much external light as possible. This may closing the blinds. Now I like you to look straight again at that look. This takes a few minutes and your eyes may feel a bit tired, so you can blink if you need to. I don't want you to look at me. Look at the lock. A. The examination is done with diamond light 3. V. A typical mediatric solution 1. C. To aid dilatation 2. Z. F. Fixate on a target 4. And 34.2. Complete the illustration. One, grab the cuff around a patient's upper arm. Two, place the diaphragm over the area of the brachial artery. Raise the patient arm so that the brachial artery is at the same height as the heart. 3. Close the valve on the pump. 4. Pump or pump, pump up the pressure to at least 150 nhg. Open the valve a little and slowly deflate it. The cuff, the cuff we listening the watching the pressure H. Five, five. The first fall you hear is the flow of blood through the brachial artery. The bulb of the gauge at that point is the historic blood pressure. 6. Con, Connuit listening while with slowly deflate, deflate it the cuff. 7. The diastolic blood pressure is measured when the sound complete disa, dis, disappear. And 30.3, 34.3. Complete the test. Phlebotomists are especially trained in trickling blood. They are skilled at bending punter puncturing the vein to take a blood sample. The reed, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. If it is difficult to locate a safe blame, the patient may be asked to make a fit or a tourniquet, maybe a plank or the upper, and to make the vein more apparent. Afterwards, a dressing is applied and patient is asked to press gently. This helps to stop the bleeding and prevent breathing at the signs. It is important that specimens both are leveled correctly before they are sent to the high methodology laboratory where a food but co or their investigation guild being carried out. Chapter 35, 35.1. Write the name of experiment for each of the suspend condition. Suspend condition, experiment, anemia, EDT, A blood, bacterial conjunctivitis, um, eye, eye swab, genital herpes swab in virus TM, meningitis, CSF, septicemia, blood culture, urinary infection, NSU, urinary infection, catheter implants, CSU, Seri point 2, excuse me, Seri 5.2. Complete the sentence describing the results of the report in the opposite. 1. Hemoglobin is with a normal limit 143 grams per liter. 2. Creatinine is slightly low, 58 mic- micromoles per liter. 3. Um, Alkaline phosphate is 11 131 units per liter. 4. 8 ALT is slightly reduced 9 units per liter. 5. Bilirubin is normal, several microbol per liter. 35.3. Write full description of the following results from a case history. Um, Sodium is normal, 138 millimoles per liter. Potassium is within normal limit for 0.5 millimoles per liter. White cells count is 11 12.2 times 10 to power 9 per liter. High Hymocould is low 0.22 liter per liter. Main corpuscle volume is down 17.5 per liters. Alkaline phosphatase is unmarkable 72 units per liter. Alkaline amino